Health officials in Massachusetts have confirmed a second human case of Eastern equine encephalitis, the virus also known as EEE. It spreads to people through bites from infected mosquitoes. Infections are rare but potentially deadly. Health officials confirm a woman in her 30s from Plymouth County, which is in the southern part of the state, just before Cape Cod, was infected. A horse also tested positive. Earlier this week, we learned a man from New Hampshire died after testing positive for EEE. So I want to bring in Allison Gardner. She's an associate professor at the University of Maine who studies infectious diseases spread by ticks and mosquitoes. You are the expert we want to talk to. So first off, how would you know if you were infected? What are the symptoms that viewers should be aware of?
Yeah, thank you for having me this morning. The first thing to be aware of is that the vast majority of cases of mosquito-borne viruses are asymptomatic. Most people who, 95% of people who get exposed to a virus aren't going to become ill, and only about a third of people who do become ill are going to experience the most severe symptoms. So most symptomatic individuals are going to have fairly generalized symptoms, muscle aches, fevers, headache, and chills during the summer. And then there are more severe, rare manifestations that occur as well with neurological symptoms.
So, I think over the past several summers, we've certainly talked about West Nile, but this is the first time I can recall talking about triple E. Why are we seeing a resurgence?
Yeah, so there is some interannual variation in mosquito-borne disease prevalence. The triple E outbreaks certainly are much rarer than West Nile virus outbreaks. The last major outbreak that we had in the Northeast was about 5 years ago at this point. And I think that probably one of the factors this summer is that we had a very mild winter and a very mild spring. And a consequence of that is that mosquitoes are better able to survive over winter. They're better able to start breeding and multiplying earlier in the season. And so there's more opportunity for mosquitoes to encounter the birds that carry the virus and then encounter humans and transmit the virus.
I feel like over the past few years, we've learned more and more about how mosquitoes find us, how they're able to see, where we are and get to us. What do viewers need to know about the best ways to protect themselves?
I think that the best way to protect yourself against mosquitoes, two strategies. First is simply avoidance of mosquito habitat at key times of day. Most of these species of medical concern mainly are active at dawn and dusk, and so it's a good practice to avoid being outdoors if possible during those times, especially in the freshwater hardwood swamp types of habitats that are used by the mosquito that transmits eastern equine encephalitis. And then another good strategy is using repellents. I generally regard topical repellents as being the most effective. So types of repellents whose active ingredients are DEET or picaridin, or also you can buy permethrin treated clothing or do home treatments as the most effective tactics.
All right, Allison Gardner, thank you.